plus his top economic team.
With an eye on markets opening across the world.
Wall Street's major indices all closed the month with double-digit percentage gains.
It's the one bulletin that offers you a global perspective. World Tonight, daily, on CMA.
奈々ちゃんは山梨名物のほうとう食べたいもの触れていません。
売りさんってオンとオフあります？
俺全部いつもオフかな。
へえ、こうやってなるんだ。
いい話。
はいはい。
Japan Hour, Saturday on CMA. Japan Hour is brought to you by Sumitomo Corporation and SMBC. This is Asia Now.
Hello there, it's 6 p.m. in Singapore and Hong Kong, 3:30 in New Delhi and 5 o'clock in Jakarta. I'm Otelli Edwards. At this hour, a defiant message from Myanmar's ousted leader Aung San Suu Kyi. She says her NLD party will exist as long as the people exist, in her first comments since the military coup. The WHO calls on nations to ensure at least 10% of their populations are vaccinated by September. Plus, India passes more than 300,000 COVID-19 deaths. The bleak milestone comes as the country battles a rise in black fungus cases and recovering patients. Myanmar's detained leader Aung San Suu Kyi says her party will exist as long as the people exist. It was her first public comments since her arrest nearly 4 months ago. Her defiant message comes as the army-led electoral body is planning to dissolve the National League for Democracy. Ms. Suu Kyi made the remarks during her first in-person court hearing in Naypyidaw. Her lawyers say she is in good health after having a face-to-face meeting for the first time since her arrest. The detained leader is facing 6 criminal charges. Included are sedition, illegally owning walkie-talkies, and breaching the country's Official Secrets Act. Violence continues to escalate between the military and anti-coup fighters. At least 4 people have reportedly been killed. 5 more were injured after security forces fired heavy weapons at a church and village in Kaya State. Clashes also erupted along the same region just hours before. About 40 soldiers were reportedly killed. Civilian forces have been allegedly using weapons from air guns to homemade bombs to counter the army. Violence also broke out near the border with China. The People's Defense Force, a coalition of local militia, overran a police station in the southern Shan state. Around 13 members of the army were killed during the raid. The group also claims they managed to capture at least 4 police officers. They warn they will continue to fight the regime. The World Health Assembly is calling for urgency to end the current COVID-19 pandemic and preventing the next one. Health ministers from 194 member states are attending virtually the annual meeting. And at the opening of the event, United Nations Chief Antonio Guterres says the international community needs to adopt a war footing to stop the COVID-19 pandemic.
The world must respond resolutely and in solidarity to stop the virus. World leaders must urgently step up with a global plan for equitable access to COVID-19 vaccines, tests and treatments. This starts with funding the ACT Accelerator and its COVAX facility to deploy life-saving tools to the poorest countries on a global scale. But that is not enough. We are at war with the virus. We need the logic and urgency of a war economy to boost the capacity of our weapons, the vaccines.
In his opening address, Director General of the World Health Organization calls for countries to donate COVID-19 vaccine doses to the COVAX initiative to help poorer countries. He also calls on all member states to support a vaccination target.
I'm calling on member states to support a massive push to vaccinate at least 10% of the population of every country by September.
The WHO chief also paid tribute to all healthcare workers for their tireless efforts. He says at least 115,000 healthcare workers have died from COVID-19 since the start of the pandemic.
In this International Year of the Health and Care Worker, we have all been reminded that these are incredible people doing incredible jobs under incredible circumstances. We owe them so much, and yet globally, health and care workers often lack the protection, the equipment, the training, the decent pay, the safe working conditions, and the respect.
Well, at the same time, the COVID-19 death toll in India has passed 300,000 as the country battles a devastating infection surge. India is the third country after the US and Brazil to pass that grim milestone. It has recorded more than 90,000 deaths this month alone. 220,000 fresh infections take India's total tally to more than 26.7 million. More than 4,400 people have lost their lives in the past 24 hours, the second highest daily death toll on record. Experts believe the actual toll is actually much higher, and that's because the majority of the country's 1.3 billion population live in rural areas where health facilities and record keeping are poor. At the same time, lockdowns in major cities like New Delhi and Mumbai appear to be stemming the spread. Infection numbers have dipped. Delhi has already extended tough measures. Meanwhile, a stricter lockdown has taken effect in Tamil Nadu. India's second coronavirus wave has overwhelmed hospitals with patients. It has also led to a severe shortage of oxygen and critical drugs. Over 196 million vaccine doses have been administered in the country so far. But Delhi and several other places say they are running low on stock. India has already suspended vaccine exports to meet local demand. India's fight against the coronavirus spread is complicated by the rise in black fungus cases, or mucormycosis. Health Ministry officials say they are increasing the supply of a drug used to treat the rare infection. India has reported nearly 9,000 cases and more than 200 people have died.
हमारे सामने एक चैलेंज के रूप में आया है कि हम कैसे ब्लैक फंगस को मैनेज करें। उससे संबंधित एम्फोटेरिसिन बी, जो कि एक एंटी फंगल ड्रग है, जो देश में लिमिटेड सप्लाई में शुरू में अवेलेबल थी, उसको बढ़ाया जा रहा है, जिसके लिए दो तरीके से एफर्ट किए जा रहे हैं कि कैसे हम सप्लाई को बढ़ाएं और कैसे उसकी अवेलेबिलिटी को और फर्दर बढ़ाने के काम करें।
Amphotericin B is an antifungal intravenous injection administered every day for up to 8 weeks in patients. Each vial costs between $80 and $100, and patients are prescribed more than one a day. States like Maharashtra and Delhi have been reporting a shortage of the drug. Ishan Garg has more on how severe the black fungus situation is and what doctors say is the probable cause.
The situation is getting increasingly bad every single day in Delhi. We don't have the numbers of how many cases are being reported every single day, but the bigger hospitals are reporting at least 20 or 30 new infections on a daily basis. So that gives you an idea of how bad things are here in Delhi. And in bigger states with a larger population, especially the ones that are more badly hit by COVID-19, like the state of Maharashtra and Gujarat, the numbers of black fungus infections are even higher. Now, several doctors are attributing the cause of this infection to overuse of steroids in patients. Others are attributing it to overuse of zinc in patients as well, while some are saying that it could be because of unsterilized medical equipment, especially the one that's being used to administer medical oxygen in patients. But of course, more data is awaited until clinicians can point their finger at what the real cause of the disease is. At the same time, the federal government has directed all medical facilities to use steroids judiciously, but several doctors that I've been speaking to say that with the second wave of COVID-19, that's not always possible when people come in with severe lung infections. So at the same time, the government is saying that there's no reason to panic at the moment, and it has advised all states to declare the infection an epidemic, but they are saying that more data will be available soon, and hopefully clinicians will be able to find a way out of this soon.
Elsewhere, Thailand has tightened its border control measures after the South African variant of COVID-19 was detected near its border with Malaysia. Authorities have placed barbed wire and checkpoints around several southern villages along the border. At least 9 villages in Takbai district in the country's far southern Norathiwat province